Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello Minister, thank you for having us again today. We're in the month of February now. How are you this morning?
Good.
Okay, so let's just start with our wrap-up of January. We've seen about 1,000 cases were recorded last month. Is it safe to say that this spike was a result of the non-compliance over the holiday period?
Well, we think so because we were warning people not to go into crowded areas and to wear their mask and so forth. But in December, we saw a lot of people not complying, and you would see those cases now popping up in January. So we're seeing the effects of the non-compliance, and we have had quite a lot of cases in January, and if we're not careful in how we manage this, each one of those active person can potentially spread it to a number of other persons. So this is something that we have to be worried about, and unless people start taking precautions and taking this more seriously, we can see potentially more increases in cases.
Okay. Can you say at this time if the total number of cases, how many of those were imported cases?
So far, since we have reopened the airport, we have had about 35 imported cases, so not a lot. And I think what has helped is that many countries now are requiring that you have PCR for travel. And so I think by having tighter measures in terms of travel, it has drastically reduced the amount of persons coming in.
Minister. Okay, now let's turn our attention a little bit to the hinterland and testing in those areas. So can you say how effective the screening, because I know the ministry would have put up several points at strategic points, screening facilities. How effective have those been?
Well, those were not permanent screening points. We did an exercise in December, knowing how people would be traveling around in the interior and getting out on the coast, to be able to screen people coming out and going in, to get a sense what is happening and how many of those persons would have been positive. And we conducted some specific exercises in a number of villages. Those have been quite effective because we were able to detect positives where we didn't have positives before. And it shows that we probably would have to develop a roving team to move around in different communities and do random checking. So that's something that we're going to be developing over the next couple of weeks. But the places where we had some testing going on, I think we were able to yield a number of positive cases. What we have put in place is that there are fixed sites in the region, so all the regional hospitals would have the capability of testing, and in addition to the antigen tests and the PCR that they're normally doing, we have now introduced the GeneXpert machine, and we are hoping to have one up in Letem, up and running within this week. They were scheduled to go in today to set up the machine and train the staff, but unfortunately I think the flight has been cancelled. But definitely during the week we have tried to get that machine up to Letem, so they'll be able to do the testing at the hospital itself. We have another machine that is going to be deployed at Mabaruma, and there's one for Linden and one for New Amsterdam. And we have bought some additional machines which we'll be deploying to some of the other regions as well.
So I'm happy that you mentioned the regional capacity. Region 8, particularly Madhya, has only about 7 positive COVID-19 cases, and you mentioned having a roving team going around to different communities to ensure that these numbers remain very low. Is there anything else that would be put in place in terms of Madhya to ensure, not just Madhya, but other communities, to ensure that numbers remain relatively low?
Well, the thing is, the only way numbers are going to remain low is if we, we have people complying with measures. And in some of the remote areas, people are not complying to those measures. And if you have one positive person enter that population and is mixing in that population, very quickly the whole population can get infected. So we have to keep re-emphasizing the whole role of education and getting people to take the necessary precautions. We also have to do more testing, so we are assisting the various regional task force in building that testing capacity so that we can detect early. And once we detect, we'll then be able to take the appropriate measures like isolation and so forth. And that's why we're buying these gene expert machines and deploying them on the site. So they don't have to even send the samples out to Georgetown. They can do it right there, and they'll be able to get back results within an hour using that particular machine. And that's more sensitive than the antigen test that they have. So they now have three options. One, the PCR, which they will do the sample and send that out to Georgetown. That would probably take a 24-hour period. They have the antigen test, which is a little bit less sensitive and can only be deployed under certain conditions. But nevertheless, it helps with the detection of the virus. And so that you can get that within 15 to 20 minutes. So you can see a patient, you can take off the sample, you can do the test, and get a result. So you have that option. And now we are adding to that by giving them the Gene Expert machines with special cartridges so that they can do testing right on the site. And that type of testing, which is closer to the PCR, would be about take about an hour to do.
Great. So for clarity's sake, Minister, when a person is tested positive using the GeneX machine, would a PCR test still be required afterwards?
No.
It wouldn't be like the antigen test where you would have to test, see if
the antigen test, if you test positive, then we know for sure that you're positive. But if you are negative with an antigen test and you do the PCR, you can become positive. And that's because the techniques that are being used. With a PCR, the process, if there are very little virus that was detected, the PCR test would amplify those viruses so that you can get a sense that the virus was present. And then they will test for that. So it's highly sensitive, highly accurate. The antigen tests, whatever they detect on the sample, that's what they'll be testing on. And very often, you can miss people who are positive. So that's the difference really between the two. There's a difference between its sensitivity.
Okay, sir. And wrapping up on regional capacity, can you give us an update on some regions that were being monitored closely last week, particularly 5, 6, and 7?
Well, I think where we are focusing on in Region 5, we still have some focus on Maracaibo, and in Region 6, we have been looking at New Amsterdam, and we are also paying some attention to the Oriella, Siparuta area. We had some spikes there, and we have seen a few cases, not a lot of cases, but a few cases. In Warramadong, we continue to have a number of cases. Today we probably had about 36 cases. And so that's an area that we are also monitoring. And it has come down a little bit from what it was last week, but we still need to monitor. And we have sent in teams to all the villages in the Upper Mas. So we had a team that was in Jawala. They're going to Kako this morning to just do some random testing and checking. And they did some work at Camarang as well. And there are plans to go into some of the other communities in that area. So over the next coming days, we want to check almost all the communities in the Upper Mas just to make sure that we are not missing cases. So that's work that is ongoing. In Region 9, we continue to see low amounts of cases. There are still a few positives, but we continue to monitor very closely to see whether or not we're picking up cases and so forth. So that's how we have been monitoring.
Okay, Minister. Now, before we go, I have a question from Startup News.
Sure.
So last August, the SIDEMA had donated about 40,000 antibody tests to Guyana. The then CMO said that these tests will be used as a screening and surveillance tool. Can you say if these tests have been used in such a capacity, and are there any plans to use them as a tool to assess the level of exposure to the virus in Guyana before vaccination?
No, these tests were really the antibody tests. Mm-hmm. So you really had to get infected before you would detect any antibody. So we have most of the tests in storage, and we haven't really used it because we want to do more diagnostic work rather than screening work. We, however, late last year, we had put together a team on surveillance, and we want to do a serosurveillance study. So we have been working on the design of this study with PAHO and with some colleagues from Harvard University and our local team. They are about completing that study design and so forth. And hopefully in the first quarter of this year, we'll deploy that study. So that study would be taking some samples of various villages and people within those villages, and we'll use this antibody tests on them to determine how many of them probably might have had the infection without even knowing that they had the infection. And there's some other study objectives that we're looking at. Now, this is not going to be used in any way to determine who gets the vaccine or not. What we are going to be doing is that persons who meet the eligibility criteria in the first instance, and that is if you're a frontline worker, then you're going to be among the first to receive the vaccine. And then when we go to the next tier, would be older people and persons with comorbidity. And so they would get the vaccine. And it doesn't matter whether you had the infection or not, because to get into those nuances would only complicate the process. So we are going to give it to everybody, and once they meet those eligibility criteria.
Okay. At this point, Minister, can you say or give us a little insight on the education campaign that will be rolled out for the vaccine before the vaccine?
Well, we have developed a risk communication strategy, mm-hmm. and based on that strategy, we would be using that to address certain myths that people might have, certain concerns that people might have, and get that information over to the general public so that people can understand more about the vaccines, how it works, how it's going to protect them, what level of immunity it would confer on them, and so forth. So you will see us shortly start doing that type of work and putting out more work, information on vaccine. And just as we are on vaccine, you would know that over the weekend at the presidential press conference that the president spoke about our efforts to acquire vaccines. And since that press conference, we have received correspondence from COVAX indicating that they have been able to do an indicative allocation of vaccines to Guyana, or doses of vaccines to Guyana, and that is going to be close to 104,000 doses of vaccines that we will be getting shortly. The vaccines are going to be from AstraZeneca, The manufacturer is AstraZeneca. And as you know, that is currently before the WHO to be given emergency use listing. So once WHO green lights the vaccine, then we'll be able to get those vaccines in Guyana. The AstraZeneca vaccines have been approved by the UK with the emergency use authorization. It has recently been approved by the European Union, and it has also been given emergency use authorization in India. And there are a number of other countries who have given emergency use authorization. So we are very happy that they've indicated to us that we'll be getting 104,000 doses as an initial start, and we would be working closely with them to see when these vaccines would actually arrive in Guyana, and as soon as we get them, we'll start rolling out. So this is much more than we had anticipated in the first wave, because initially they had told us that we'll get a smaller sum in the first wave, but now it seems that we'll get a bigger lot. But we are nevertheless prepared to receive the vaccines, and as I've said before, we have already trained our teams to start going out and using the vaccine.
Okay, just for clarity, Minister, I know with the Pfizer and I think the Moderna as well, you get 2 doses of the vaccine. Is it the same with AstraZeneca? AstraZeneca,
it's also 2 doses, and so you have to get a first dose, and then you get the second dose after 21 days, I think.
Okay, thank you very much for that, Minister. Thank you for your time today.
Okay.
This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or visit our social media platforms.